My name is Hiral Naik. For those of you that don't know me, I am the chair of the Snakebite Community Engagement Network, and we are very excited today to, as a steering committee, bring you a very cool webinar presented by Chloe Vasquez. So I'm going to hand over to Chloe, and she's going to just share some of her experiences of snakebite in India. Over to you, Chloe.
Great. Thank you so much for that introduction, Hyrule. So my name is Chloe Vasquez, and I'll be presenting on snakebite in India. So for those of you who don't know me, I'm a recent undergraduate in May from Macalester College, where I studied economics, political science, and public health. So just keep in mind that I'm not a clinician or a scientist. And I got interested in the world of snakebite in 2020 when my mom suffered a bite from Bothrops asper in Costa Rica. So you can see her in this middle picture celebrating her birthday in the hospital. And I later realized that she was very fortunate to survive this incident because she had high quality antivenom and a really good public health system that focuses on snakebite support in Costa Rica. So I've been interested in snakebite ever since. And right now I'm completing a 12-month fellowship around the world with the Watson Foundation, which is connected to IBM Tech Company. So I'm 6 months in, and most of these 6 months have been spent in India, all around some different actors. And these are across very many different sectors that all work on snakebite. So this is bridged from conservation to public health to the clinical side of things, policy, and grassroots education, among others. So today I'll just give a very brief introduction to the problem of snakebite, since you all are already probably experts. I'll talk about snake rescuers and snakebite prevention, venom and antivenom, the health system as it pertains to snakebite, and then the National Action Plan for Prevention and Control of Snakebite and Venoming. And then following that, I would really like us to have a discussion because there are a lot of people here from different expertises and different institutions that have a lot of deep knowledge in these. And today I'll be going kind of a mile wide and an inch deep. So maybe everybody can share from their point of view, their thoughts on these things and clarify. So as you all know, India is the world's snakebite capital. It accounts for half of the world's snakebite deaths. That's about 60,000 deaths due to snake bites annually in the country. And that means over one person dies every 10 minutes due to a snake bite in India. And besides these deaths, there are many other people who are left permanently disabled, traumatized, depressed, and in severe financial debt. So why are there so many snake bites in India? Part of it is local biodiversity. And then there are also a confluence of other factors like unfortunately in India, the monsoon season coincides with harvest season, which also coincides with snakes breeding season in many cases. And so there's a lot of human snake conflict, which can result in accidents. And about 90% of these bites are estimated to be caused by the so-called big four venomous snakes of India. These include the common krait, spectacled cobra, saw-scaled viper, and Russell's viper. But besides these venomous snakes, there are also many other species of venomous snakes that cause bites and a public health impact, such as the monocle cobra, pit vipers, and the ended krait, among others, many kraits. And so in India, we currently have one formulation of antivenom, and this is against the big four species. And so antivenom has to be species specific and region specific. So whenever the antivenom is made only using big four species from Tamil Nadu, where the great majority of venom is sourced, it means it's not as effective in the north or in the northeast. So there are a great diversity of religions in India, and in many of these, snakes are considered sacred. And so one outcome of this, which is less fortunate, is that some people may choose to seek faith healers following a snake bite. And there are many other reasons why people may choose to use traditional medicine. These could include familiarity. They've heard of a certain herb, it worked for someone else. And so whenever they got bit by a snake, they might choose to use this medicine. Distance to hospitals could also play a large role in why people choose to use traditional and faith healers. Affordability, oftentimes traditional medicine is cheaper. And then people may have distrust of allopathic medicine. For example, if somebody from the community came back with an amputated limb, they may feel fear when it comes to going to the hospital. But as we all know, delays in getting specific treatment for envenoming can be deadly. And so one way that people are combating this issue is education. And one of the key things I think is education specifically on dry bites. So among other things, people are teaching about snakes themselves, they're dispelling common snake and snakebite myths, they're improving the identification of snakes, teaching appropriate first aid. And I spend most of my time in Madras Crocodile Bank Madras Crocodile Bank Trust in Tamil Nadu, but there are very many organizations that are working on education and community outreach. And so Croc Bank, one of the things that they do is called training the trainers. And so they partner with community-based organizations to hold these workshops and share this knowledge. And so I also got to see that they make posters, they have songs, they do workshops to teach people about snakebite and all of these things. But unfortunately, education is not as easy as it sounds. Behavior change is very complex and it takes quite a bit of time. It takes trust. And besides that, it's very hard to measure the impact of these educational activities. So you can take pre and post surveys and you can follow up 6 months later. But at the end of the day, it's very difficult to tell how many snakebite deaths have been avoided due to a workshop. And this difficulty to quantify can sometimes make it difficult for governments and funders to prioritize education and outreach activities. And so this is a challenge that many of these organizations face. I had a great opportunity to visit Rides in Sangamner, Maharashtra, which is a community-based organization that, among other activities to support communities, does community outreach and workshops to teach people about snakes and snakebite prevention. And they also have rescuer networks. So these can be seen down here. And all of these people are passionate about snakes and the community. And so anytime there's a snake in someone's house, they go and they take the snake out of the house and they relocate it somewhere else. And these guys are working on a volunteer basis, mostly out of passion for the work. So that was really exciting to see the level of trust that this organization has with the community, with just the community members, also health agencies and doctors. They steer people towards public health facilities or private health facilities that can give them low-cost care. So big impact. I also later visited the Agumbe Rainforest Research Station. And on my first day, I remember I met Ajay Giri as he had just gotten a call to do a rescue for a king cobra. And so he gathered the information and then we went flying in the car to this person's house. He talked to them and had everybody step to the side as he went and rescued the snake. And the whole procedure was done in 60 seconds or less. And afterwards, he sat down with everybody, as you can see here, talked about what steps you can take to keep snakes from getting too close to your home, what you can do in case of snake bite, and he delivered pamphlets to everyone. And it was incredible to see just how much attention everybody was paying because they had just had this huge snake in their house. And so they were hanging on every word he said. So I really saw the potential of snake rescuers as these vessels of public health knowledge. Besides rescues, Agumbe also conducts ecological snake research. So they've been studying the behavior of king cobras, and they also engage in telemetry. So they can put trackers inside of snakes and then watch their movement. So they've put trackers into king cobras and that they're relocating for these rescues. And what they found is that the king cobras that are relocated will just circle and circle, and they won't eat or drink until they eventually die of stress and dehydration. And so what this means is that translocated snakes have a very high mortality rate. Besides this research and the rescues, Agumbe also does workshops to teach people about wildlife of Western Ghats. So I got the incredible opportunity to see some snake rescuer trainings. Madras Crocodile Bank is working with some forest departments in Assam, West Bengal, and Odisha that I saw, and they're also working with other states to conduct snake rescuer trainings. And these are targeting NGOs and also forest departments that are already conducting rescues. And as I was talking to Gnaneshwar and other rescuers, I realized that there's also a darker side to this rescuing trend. Many people don't do what Ajay does. They get into the house, they spot the snake, they pick it up with their hands and they start showing off. Everybody's taking videos, they post it. And so this places them in great danger. Many people get bitten and unfortunately die. And it also places the public in danger if the snake is riled up and bites someone else. And besides this, many young people will see these videos on the internet and get inspired to do the same thing. And so it's almost an infection of these rescuers on social media. So one of the goals, among others, of these trainings is to teach people safe and ethical rescue procedures, not using tongs, which can injure the snake, and not conducting rescues in case of a non-venomous snake or in case of a venomous snake, which is away from people's dwellings. In those cases, it's really not necessary to move the snake at all. These rescues were also a good opportunity to implement snakebite apps. So for example, SARPA was initiated in the state of Kerala, and this is considered to be the Uber of snake rescues or accessing hospitals. So basically, the user can report seeing a snake, and then the closest rescuer will come and extract the snake and move it. Or if there's been a snake bite, they can report the snake bite and find the nearest hospital with antivenom. So the successes of snake rescuers, they have a lot of potential to reduce human-snake conflict. They have a lot of potential to have great relationships with the community. The moment that they get that snake out of the house, they have a lot of respect. And so this could be a great vessel for communicating public health initiatives. Some of the continuing challenges, a lot of snake rescuers still conduct stunts. A lot of them, these stunts are influencing youth and placing the rescuers and also the public in danger. There are a lot of unnecessary rescues that are just for clout, basically. And then relocation could be causing snake death. Rescuers might also charge fees to community members. While a lot of them are expected to work on a volunteer basis, if they're charging high fees, this could discourage people from calling in the future. So, oops. So for most of the past 6 months, I've been based at the Madras Crocodile Bank Trust. And within the Croc Bank is the Irlar Snake Catchers Industrial Cooperative Society, the Irlar Co-op. So the Irlar are a tribe that are considered to be some of the last so-called forest scientists. And they have a wealth of knowledge of local ecology, local medicinal plants, and they have a specific knowledge in catching rats and snakes. And this was largely their income, was selling snake skins up until the Wildlife Protection Act of 1972, when this became illegal. So during that time, they shifted to catching these snakes and extracting venom. And at this point of time, they're estimated to be providing upwards of 90% of the venom for antivenom production in India. So this organization is immensely significant for the snakebite situation in India. So what they do is they get permissions from the Tamil Nadu Forest Department, and they go out and catch snakes in neighboring fields and farms. And they bring these snakes back. They're paid per snake, and they keep them in these clay pots, which protect the snakes from the heat. And then they keep the snakes for 21 days, during which time they extract venom 4 times. So it's about once per week. And they clip the scales of the snakes so that they know which ones have already had their venom extracted. And then after that 21-day period is up, they get permissions from the forest department to release the snakes in designated areas. And so unfortunately, there are still a lot of quality and sustainability issues with this model. First of all, the venom production does not comply with the World Health Organization's good manufacturing practices. The pit, which is this area here, is open to the public. So there's a crowd of people standing around. The floor is made of sand, and there's a lot of possibility for contaminants to enter the venom. There's also an over-extraction of venom. This period of 7 days is way too frequent for the snakes to regenerate all of the toxins in their venom. And that means that the resulting antivenom is not going to be representative of what a snake bite would look like in the field. Besides this, there are some temperature control issues. They do have a fridge beneath the venom extraction location, but I have my doubts that the venom is actually reaching the -20 Celsius that it should be. And also it's not very traceable whenever you're catching snakes and extracting their venom this way. Besides this, since they are dumping all of the snakes at once in one designated area, all of these snakes are, first of all, stressed. We saw that located snakes don't fare well. They're all competing for the same niche, and there are a lot of peacocks around where they're released, so they just swoop in and eat a lot of the snakes. And already it's getting harder and harder for them to meet quotas of venom, especially for kraits and saw-scaled vipers. And at the same time, permissions to catch the snakes often come late. So this means that they have less and less time to catch snakes, and they have to go farther and farther every time. So the Tamil Nadu government has decided to shift the irregular co-op to a serpentarium model. But so whenever I first arrived to India, one of the first things I did was go with a few of the irregular from the pit who extract venom, and we visited some of the nation's leading serpentariums and venom extraction places. So one of these is the Liana Trust, based in Hunsur. We also got to visit the Indian Institute of Science and the Evolutionary Venomics Lab, and we also got to see Hafkeen Antivenom Production Center. And I got to spend a little bit more time with the irregular following this period, and I realized that the serpentarium is not a popular suggestion among the irregular. First of all, there are 330 irregular who hold licenses, more or less, to catch snakes. And around 10 of these people also work in the pit. And so a switch to a serpentarium model would leave many of these people, most of them, unemployed. How many people does it take to run a serpentarium reasonably? And besides this, the government has been working to reskill this community, but this is a complete shift away from their traditional knowledge and something that's a great source of their identity and pride. And so just shifting them to another job is not so simple. And at the same time, a lot of them don't see any problem with the current model of the way that they're producing venom. They see the venom as good, people are buying it, and there's a lot of rumors and dialogue that's going around in the community from different sources that the venom is okay, they don't need to shift. And so in general, communication between stakeholders and the community is not very clear. Besides the irregular, the venom market is really a bit of a wild west. It's very difficult in India to start a serpentarium. there's a lot of permissions and bureaucracy that people have to go through. And this is because snakes in India are protected. I did get to visit Manosha Biotech in Calcutta, and they've been reporting to have been selling venom to antivenom producers for the past 2 to 4 years, including banded crate and monocle cobra venom, which would be interesting because as of right now, the antivenoms are formulated for the big four only. In addition, some snake rescuers are selling venoms on the black market. Some of this is for maybe narcotics or other purposes, but there are definitely accounts of people selling venoms to the antivenom producers. There are a lot of new players entering the market, so this will hopefully improve the situation and provide other options for venom purchase that are higher quality. So the Liana Trust and Hansur will be opening up their serpentarium in a few days, I think. In addition, I know that the Indian Institute of Science is working on a state-of-the-art serpentarium. There's the Gujarat Serpentarium, who has been testing their venom, and from what I've heard so far, it's very high quality. And in addition, a lot of antivenom producers have expressed interest in starting their own serpentariums. So the antivenom producers themselves face many challenges. For one, there's the issue of late venom delivery. The quality of this venom is very low. And in addition, the production costs are high. Antivenom is a biological product, and so it has to be very pristine with state-of-the-art equipment. And there's a lot of variables that are constantly moving. Demand is difficult to estimate. You never know when you're going to get a natural disaster and a ton of snake bites. And at the same time, supply is inflexible. So if one company wants to ramp up production, they have to acquire horses, immunize those horses, which is at least 6 months, formulate the antivenom, do all the testing, and get it on the market. So that is going to take a long time. So on one side, you have high costs, and on the other side, in India, there's a price cap on antivenom of 460 rupees per vial. So that's about $5. And that makes it not very profitable, which is one reason why many pharmaceutical companies are not interested in producing antivenom. So successes in India, the antivenom is fairly widespread and affordable compared to other countries. There are multiple manufacturers, which is more than can be said for most of the world. And also India is home to many experts in snakes, venom, and antivenom sera. So there are a lot of people who are doing good work to ameliorate these problems. There are also relatively good supply chains, so we can get the antivenom out. The challenges: antivenom does not cover local biodiversity. It's made for the big four venomous snakes and mostly for Tamil Nadu snakes. And so if you get bitten by a non-big four snake, you're kind of out of luck in terms of antivenom. In addition, the venom quality is poor. The potency of antivenom in India is relatively low, and some studies have suggested that it's getting less potent over time. And in addition, there are relatively high rates of reaction, allergic reaction, and anaphylactic shock. And besides the low quality venom, there could be other factors impacting the antivenom quality. I've heard some reports of extracting the plasma from horses too often or more than the recommended amount for the body weight, or many other ways that that pyrogenics could get in. So there's a lot of ways that antivenom can go wrong. So I got to see the health system from a few different points of view. I saw some community health centers up to big snakebite hospitals like TCR, as you can see on the left. And one of the first things I learned is that treating a snakebite is much more than just antivenom. I got to see a presentation by Dr. Mohan, which talked about neostigmine and atropine in the role of treating neurotoxic snakes, using ventilators to support breathing, adrenaline in reducing allergic reactions. And so there's a lot that goes into treating a snake bite. In addition, envenoming is not always easy to diagnose. It's not always evident that there are fang marks. They might look like scratches, or they may not even be present. And it's hard to differentiate the effects of fear or panic and then the effects of the venom itself. Besides this, it's difficult to treat patients who arrive very late due to transportation difficulties or delayed arrival due to traditional medicine use. And the great majority of clinics are not equipped to handle snake bites. So doctors in India are not trained in most cases. They don't always have the technology. They don't have the supportive medicines. And this has a lot of knock-on effects. So people are often giving overdoses. And for example, if people get bitten by a non-Big Four snake, they may give antivenom, see that it's not working, give another dose, give another dose. And so I've met a doctor who administered upwards of 130 vials of antivenom. And so that's way too much. The maximum recommended dose is 30 vials. Besides this, they may give underdoses for various reasons, whether to save the patient some of the costs or to because they are not aware of what a dose of antivenom should be. There's also been inconsistent data reporting. Some facilities do report, some don't. But hopefully this will be changing because now in India, snakebite is notifiable. There are also incredibly high out-of-pocket costs at private hospitals. Most public hospitals are not able to handle snake bites, or if they do handle snake bites, it can be a lower quality of care compared to some private hospitals. A lot of work is being done to remedy this situation. So to fill this knowledge gap among physicians, I got to see one amazing training in Shillong where Dr. Mohan, seen on the right, was giving a talk on the management of snake bites. And then on the left, you can see a wilderness medicine conference where I'm learning to intubate, and I failed. And so a lot of doctors can learn more about the skills they need to take care of snakebite patients. Some other anecdotal concerns. Apparently, there's a lot of ways to do the 20-minute whole blood clotting test incorrectly. If you have, if the test tube is dirty in any way, or if you do the thing wrong, then you can misdiagnose whether there was a snake bite and envenoming or not. In addition, fasciotomies may be happening more often than is necessary. And so people may get excited and do a fasciotomy. In addition, I've heard of some incentives that have been given to ambulances for bringing patients to private hospitals rather than public hospitals. And besides this, some doctors may be feeling unconfident about their ability to handle a snakebite patient. And so they may send the patient off to protect themselves from a bad reputation in case the community gets angry and attacks due to a snakebite death. And so they'll just send the patient off without stabilizing them. And then the patient can die en route to another facility. And they could also refer late if they're doing all of these tests, but they have no capability to treat an envenoming patient. And then by the time the patient is showing severe symptoms of envenoming, it's late. Some successes: snakebite treatment is free in public hospitals. And all treatment is free in public hospitals. Most major hospitals do stock antivenom. And if doctors don't know how to handle a snakebite patient, they can call poison control centers. And so these control centers, just like in CMC Vellore, can help identify snakes and can walk the physicians through appropriate snakebite management. In addition, the Indian government and other organizations are organizing trainings for physicians so that they can better handle snakebite patients. And snakebite is a notifiable disease in India. So now more facilities will start reporting snake bites. Some more challenges: traditional medicine use is very common, and this can delay access to specific treatment. Hospital access could be greatly improved. Health facilities are still largely underprepared to handle snake bites, and antivenom misuse is still fairly rampant. And there's also a large financial burden that accompanies treatment at private health facilities. So India on March 12th, 2024, was the first country to launch a national action plan for the prevention and control of snakebite envenoming. And this is a holistic, multi-sectoral national policy to reduce the snakebite-related deaths by half by 2030. And so to complete this goal, they're hoping to increase awareness. They're funding antivenom distribution. They've released guidelines for clinical snakebite treatment, and they're trying to improve healthcare infrastructure and improve the surveillance. So some successes, besides the government initiatives themselves, the NAPSE has triggered a wave of action. I feel like things have been moving very quickly in the past 12 months. And this is partially because the NAPSE has given a sense of legitimacy to the snakebite issue. States are now working on their action plans. The NAPSE is more of a national guideline, but the implementation itself will have to be done at a state level. And so all of these states still have to release their state action plans, but people are working on that. Regional venom centers are under construction right now, and so that will really improve the effectiveness of antivenom. Some of the challenges, antivenom regulation can be greatly improved. There's still a lot of issues with antivenom in India. The structure of the Indian government is such that the states have to do the implementing. So it's going to be maybe some time before all of these great things really happen. Working between sectors can be a little bit logistically difficult. And then all of our data in the past was based off of estimations. So it's hard to move resources in a correct way. In addition, just like the rest of the world in snakebite and in government, a lot of initiatives can be pushed by one person who's passionate about an issue and taking a lot of action. And then that person changes position and everything starts from zero. And so this is also a problem with these initiatives. So I'm very optimistic about the future of snakebite. I've heard about a lot of groups that are finishing up some diagnostic tests for envenoming. And what this could do is really help with these non-big four bites to tell us whether the antivenom is going to be effective or not. And also to be able to tell whether or not envenoming has really occurred. In addition, people are working on regional venoms and antivenom production center, which will greatly improve care. And in the more distant future, but I'm very excited about it, are novel therapeutics. So on one hand, we have small molecule inhibitors, such as veresplitib from Ophorex Incorporated. And this is a drug that can be administered orally. And so as of right now, it's recommended to be a complement to antivenom rather than a substitution, but it neutralizes the PLA2 toxin, and it has been said that it can even reverse paralysis. So we're all excited to see Ophorex veresplitib in the market, and there are also others. There are also next generation antivenoms, such as recombinant nanobodies. The Evolutionary Venomics Lab has been working on these. And these nanobodies can act more quickly, they're more effective, they can target even more proteins than the current antivenoms. And since they cut out the whole venom side of things and the horses and plasma, if I'm not wrong, they could be a comparable or lower cost substitute for the antivenoms. In the future, we're going to have climate change. So who knows how that's going to change the landscape of snakebite. And then also global politics, as we're seeing, may change the way that things are functioning and getting funded. So we will all see. But I just want to take some time to thank all of the people who showed me around this country, showed me around their work. It was a really big pleasure to learn about everything that you guys are doing, and you've given me hope that the future of this neglected disease will be a little bit less neglected. So thank you very much. We can maybe all discuss now. You guys can correct anything I said wrong. But quickly, here's a blog that I've been writing about snakebite if you want to learn more. And then you can contact me with my number or email down below. And I'll also drop a link for my blog in the chat. So thank you very much.